Is it really becoming a trend to consolidate the various disciplines related to neurosurgical, and even psychiatric, psychological treatment into one institute? What are the advantages, and on the flip side, the disadvantages? So, Dr. Ted.
Well, we're not really consolidating. You think I'm still with the Department of Surgery, so are you. Dr. Malu is still with the Department of Internal Medicine. So we're all still in our, in our mother departments academically. What we do here is we look for the intersections of our interests, and where those intersections are, we can shine and help each other. So maybe we're not really consolidating because it's a multidisciplinary thing. We all come from different disciplines now. Though administratively, we actually belong to different departments. The advantage, what we've talked about kanina, about being able to put all our, put all our specialties to bear, bring our strengths to bear on a problem. For me, the disadvantage would probably be the amount of time we have to do for this, because this doesn't happen in a vacuum. We still have to spend time for this, and in a sense, that's a disadvantage because it just, you do this outside of your clinic time. We have to make time to come together and to do these things. It's not really a disadvantage. We enjoy coming together, but it does. If you think about it, this could be time that you could spend elsewhere. The second part is stature. So the stature is a loaded word. I think from my own experiences, having done, maybe for you, Mike, having done fellowship abroad, I think, and our patient who's an OFW from Dubai, I think we are some of the best in the world. We just don't give ourselves enough credit. I think the neurosurgeons, the Filipino surgeons, actually pretty good from what from my own experience abroad. And as far as skill and competence, I think we're really second to none. Where are we? Saan tayo saan tayo na dedehado? We are a third world country. We don't have all the toys. We don't have that strength of research, though. It's nice to know that we are coming up on that. As far as research is concerned, we're gaining there. We're getting there. But maybe that's where we're a little behind. But I think if you're going to ask us about how skilled we are or how competent we are, I think we're pretty good. We're up there. The third question has to do with advancements in CSMC. I think this has been talked about by Mike, by Gilbert, and Malu, Dr. Malu. So I think that's been answered through all of our lectures.
There is a lot of contradicting information on the internet about tumors, but a lot of people choose to search. Sorry, I lost that. But a lot of people choose to search up this information in an attempt to self-diagnose or self-examine themselves. How can we encourage Filipinos to seek medical advice over checking their symptoms on the internet? Second, how do we curb the growing apathetic behavior towards early cancer detection because of this? Third, what can we advise people who rely on the internet for checking their symptoms? Dr. Malu?
Thank you, Mike, for that question. Okay, so as I have already discussed in, I think, the last portion of the talk, the internet is really a very powerful tool, but unfortunately, it does not give you the big picture. It gives you bits and pieces of information, but because you're not talking to a doctor, you don't really know how to put them together, and so you don't really know what to do with that information that you get. So it is all right to search the internet. As I mentioned, it's better to go to reliable sources. But at the end of that research that you make, you bring it to the doctor and verify that information and see whether whatever you have gathered applies to you. And obviously, the internet cannot treat you. Google cannot treat you. It can only give you information. So even though you find out that you have, for example, a tumor, and based on what you have gathered, it may probably be harmless, you won't really know whether it's harmful or harmless unless a doctor examines it, takes a sample of it, brings it to the laboratory for biopsy, and then that's the only time you find out whether it's benign or malignant. No, so because of that, it is very important that you consult a doctor, that you consult your physician, and also ask your physician to refer you to the appropriate specialist. Now, when it comes to cancer screening, the Cancer Center in particular, and as well as the several organizations, including the Philippine Society of Medical Oncology, are very active in promoting cancer screening. So every month we celebrate a particular cancer. For example, October is Breast Cancer Month, and that's the time we really promote mammography and early screening to be able to detect cancer early so that we catch it at the time that it is still curable. So what is very important to emphasize is that cancer does not have to be deadly. It does not have to be a death sentence for any of us, as long as we are vigilant, as long as we catch it early and treat it appropriately.
Because of Filipino stigma, as well as lack of education on the importance of getting regular checkups, many Filipinos dismiss symptoms that might be signs of a deadly disease. How do we convince Filipinos of the importance of getting themselves checked for these possible issues? Dr. Ted, can you take this question, please?
Yeah, I think Dr. Malu answered this. No, so the doctors, our professional organizations, do promote cancer awareness. But the other thing about this is it's a cultural thing, at least probably for Filipinos who don't want to bother their relatives with what they're feeling. I see this a lot with some patients, that they don't want to bother their wife or bother their kids about something they're feeling. So they keep it, worrying about maybe it might disrupt the family or cost something. So that it's a cultural thing. I don't have an answer to how to do that, but I think the first step really is making people more aware, and our professional societies are doing that.
Thank you, Dr. Ted. Next question. How would you know which is the better option? Dr. Ted?
Yeah. Actually, there's no...
Oh, I'm sorry. Yeah, go ahead.
Yeah. There is really no better option. I like to think of the Gamma knife and surgery as complementary to each other. There are times where there are situations where a Gamma knife would be the primary option you'd like to pick. Maybe for smaller tumors, it would be nice if we have a picture of that. But small tumors, which are deep inside the brain, which are still not affecting the brain so much, and you'd like to be able to treat it without injuring inflicting further injury. So this is where the Gamma knife is strong. If the tumor is already very big, really the better option, especially if there's compression of the brain, the better option might be open surgery. And there are times, like Mike, we know this, there are times when we have to use both modalities to be able to address a problem.
Thank you. Dr. Gilbert, you'd like to make additional comments regarding this question? Which is a better option, Gamma knife or open surgery? I mean, speaking from the open surgery side.
Yeah, well, there are certain tumors that are better Gamma knife, and there are other tumors that are better excised, no? And still, no, the others naman would respond better for chemotherapy. So basically, there are different factors that come into play. Number one, the most important, I think I mentioned it in my lecture, is the histopathology. So some tumors, let's say gliomas, may not be applicable for Gamma knife radiosurgery. So histopathology is really plays an important role. As I've said in my lecture, specific or different tumors would have different types of treatment. No, it can be surgery alone or a combination of the different modalities. And then Dr. Ted mentioned size. No? One of the limitations of Gamma knife would be the size. If you have a huge tumor that has mass effect, I think that's the time when surgery becomes a better option. Another factor is location. If you have a deep-seated tumor, and I'll exaggerate, no? If it's in the brainstem, you don't want to touch that with surgery. Just the same, if you have a very superficial tumor, it's just there, and it's a benign location, and you can actually afford a total cure by doing surgery, then I think it's really the best option. And then probably number can also be a factor. Of course, you have, I'll exaggerate again, probably if you have 14, 15 tumors, surgery will not really matter if you take out one or two. Obviously, cannot take out all of the 14 or 15 tumors. Then radiosurgery or radiation can be the best option in this scenario. So,
like, ordinary Filipinos view cancer treatment as something only rich people can afford, which deters them from seeking both medical advice and medical treatment. What can be done to change this mindset? And does Cardinal Santos have any programs in place that can help patients afford these kinds of treatments?
Thank you, Mike. Thank you to whoever asked that question. So at Cardinal Santos Medical Center and at the Brain and Spine Institute, we have the Philippine Alliance for Brain and Spine Tumors. This was inaugurated at the same time as the Brain and Spine Tumor Center. And this foundation is helping and has helped hundreds of patients get free treatment, even free diagnostic modalities such as MRI. So, and aside from this, there's also the Cardinal Charities Foundation, which also helps indigent patients get big discounts and even actually free their free procedures, especially those that are admitted under our residence service program. Outside Cardinal, we also help the patient get support, financial support from their local government units, the Philippine Charity Sweepstakes Office, as well as DSWD. So what I always tell my patients is that if there's a will, there's a way. Lack of funds should never be a deterrent to seeking medical help, because we, your doctors, will find ways. Believe me, we will find ways to help you. We will actually even call drug companies to help get free medicines and stuff like that. So just do that first step of consulting, and we will deal with the other problems later on. Even if it's Cardinal Santos, it's a private hospital known to cater to the A and B crowd. Even our indigent patients can get help from us.
Can developing lumps, tumors, or cysts be avoided? What do Filipinos need to do long term so that they can avoid developing these?
All right. So it depends, no? It depends on which organ you're talking about. So there are, of course, certain tumors that are linked to our lifestyle. For example, lung cancer. You can certainly avoid developing lung cancer and even other cancers of the head and neck, no, particularly the vocal cord or the nasopharynx, if you just quit smoking or don't start smoking at all. Okay? So colon cancer, for example, they say you can prevent colon cancer by getting, for example, an early colonoscopy, at the screening colonoscopy at the age of 50 years. And if the doctor detects a polyp, a pre-malignant polyp, and takes it out, then you prevent developing colon cancer. Aside, of course, from maintaining healthy weight, exercising, and proper diet, a well-balanced diet rich in fiber. So there are many things that you can do in order to prevent developing certain types of cancer. But brain tumors, for example, glioblastoma, it is largely a genetic disease for which we have no preventive measure. Okay, not avoiding using cell phone or whatever. These things do not prevent brain tumors. So it really depends on what tumor you are considering in this particular question.
There is a rumor being spread around about tumors that kapag mas malapit sa utak, mas nakamamatay. How true is this statement, and what are your thoughts on this?
Not necessarily true, and I'll answer that by giving an example. Let's say you have a benign tumor, and the key word there is you have a benign tumor in your brain, and you have a malignancy. What? Ilayo natin, let's say a pancreatic carcinoma, which is what we know na it can be very quite, aggressive. So just by comparing the two, no, kasi the premise there is wrong. So the premise there is the nearer the tumor sa brain, it's more lethal, it's more malignant. So that by itself, I think it's erroneous. No? So again, I've emphasized this quite a number of times. The histopath is really the key here. There are tumors that will give you a clue na it may be benign. No? Once in a while, we hear that if you can palpate them. But the thing is, with CNS tumors, you cannot palpate them. You will develop symptoms, and you really need to consult the specialists, neurologists, neurosurgeons, oncologists, and they are the ones whom you really have to rely on. What imaging to get.
If I have been diagnosed with a brain tumor, is it really necessary to remove the tumor even if it's benign?
Not always. Again, I'll answer that by giving examples. I actually have a couple of friends, even a relative, whom I am observing for the past so many years, and they have benign tumors. One of the more common benign tumors that I observe, and I'm sure the other neurosurgeons do observe, is an arachnoid cyst. So that's a relative of mine who's from the States, who would come to the Philippines. This is pre-pandemic, of course, to get an MRI and show me an MRI. So that's his routine. I've been observing that cyst for the longest time, and even a friend of mine who has a meningioma. Again, this friend of mine is a nurse, works in the States as a nurse, and she has the tiniest meningioma. It's a benign tumor, and of course, when you work as a nurse in the States, you have access to all those like gamma knife. So she's free; she can get it for free, and yet she doesn't want to. So I've been observing that for so many years. So generally, benign tumors that are asymptomatic, to say they're not doing anything, you can observe them. So it will again depend on the histopath, the size, the location of these tumors.
Even in the smallest of tumors can incite anxiety in someone, making them fear the worst. What can you advise patients who have discovered they have a tumor and are worried about getting diagnosed with cancer or are already diagnosed with cancer? What do family members of people who discover they have a tumor, whether benign or malignant, need to know to help them? Dr. Ted? Dr. Ted, can you take that? I think
Yeah. So if you have a family member who is diagnosed with some sort of a tumor, I think the first thing you have to do is get data, find out more information about it. Visit your doctor and find out what the problem is, what exactly the problem is, what are your options for treating, and that will help alleviate some of that anxiety. What can you advise patients who have discovered they have a tumor and are worried about getting diagnosed with cancer or already diagnosed with cancer? I think this has to do with anxiety. That's a tough question because that will vary from person to person. I have to ask Malu, we're multidisciplinary. How would you deal with this? I'm thinking you have more patients who have more anxiety.
Sorry. What is the main question? Sorry.
How do you deal with patients who have anxiety about having a
Anxiety.
tumor? Yeah.
Oh, okay. It really boils down to establishing a relationship with the patient. Now, once you have established a relationship with the patient, you kind of have that ability to calm them down and make them a little bit more objective about what the steps that they should follow in order to determine whether this is really something they should be anxious about, or it's just something that that can actually sleep off. No? So that's first and foremost. And secondly, there's always, especially amongst Filipinos, what I find very useful and very actually it really works for them is praying with them. When you pray with them, somehow it soothes their spirit and it calms them down and it gives them a clearer mind now to understand the pros and cons of certain procedures and also the realities of a certain diagnosis. And then again, thirdly, I think it's also about the confidence that the doctor has. Because sometimes some patients just tell me some doctors also can be very anxious. They come across as anxious. They make patients afraid of their diagnosis, a bit threatening. So it also helps to be on the calmer side when you discuss especially a cancer diagnosis with the patient. It always pays to give them that hope na even if it's cancer, something can be done.
Thank you, Malu. Thank you, Dr. Ted. If you guys will allow me to add something, the first thing I always mention to a patient and his or her family, is that the first session, the first meeting, is for me to be able to educate them about their disease. I think it all starts with educating these people, our patients. Then from there on, they start being less anxious, they start understanding more, they get to know about the natural history of the disease. So I think that really calms them down significantly. Considering that you already have an option in Dubai, why did you choose to do the procedure at Cardinal Santos Medical Center?
Okay, thank you for that question, Dr. Jimenez. First of all, before I answer the question, I was taking notes on what Dr. Luisa was saying about getting diagnosis, not a death sentence. If there is a will, there is a way. Calming your patients. So I can really reflect on all these things. This is the feelings that I had initially. So I thought it was a death sentence for me already. And then I look for options. So I thought it will be a problem for me to cover the expenses. But it was not, it did not come to a point that we have a problem with the financial. So everything come into place. So when we approach Dr. Jimenez as well, the first thing he did is to educated us, and he calmed our family, and then we understood what are we going through. Okay, so I'm just happy to express that gratitude to the team. And okay, so to answer the question, I already have an option to do the surgery in Dubai, but I still choose to be here. So our consideration is number one, I'm alone staying in Dubai. We thought of the recovery, the support system for me when I post surgery, and then we look at the expertise. So we did our research, and we found out that in our country we have the best doctors that can cater for this kind of tumor or can cure us. So it was after we have that first meeting with Dr. Jimenez, we confidently decided that I will be here.
From the story of Mr. Rodel, vertigo can be a symptom of brain tumor. How do you know if you have to consult an ENT, a neurologist, or a neurosurgeon for this symptom?
You can actually consult any of them. No, there is no best. I can be biased, but I think that's a wrong notion. No, there's no best doctor for this. There are really overlaps. So specifically for Rodel's issue, no, I think the fact that he was sent to us, we ended up with a happy story. No, he went to the right doctors. No, the first doctor, if I'm not mistaken, was an ENT, and if not for that guy, he wasn't able to get a CT scan, which probably is a reason that led him to visit a neurosurgeon. And if he or if he made a wrong consultation, he probably wouldn't end up this way, having a successful story. So there are a lot of overlaps in our fields. Let's say here, we're talking about brain and spine tumors. We have an oncologist, we have neurosurgeons. You can even add in neurologists. You can even have your orthopedic surgeons for spine. So it's not just your neurosurgeons and your medical oncologists. Okay.
Thank you, Gilbert. So whoever you see first can actually direct you to the more appropriate specialist as well. Let's say I had a CT scan 5 years ago, but I suspect having a tumor now. Will it quickly grow with the first scan? Or is it possible that it develop only after the first scan? How fast can a brain tumor develop?
I think that depends on the brain tumor. No? If you have a benign tumor, like a meningioma or a schwannoma, it may or may not grow so much over 5 years. I'm assuming the first scan they saw something. 5 years, it may or may not grow. Some meningiomas are really very indolent and they don't grow at all. But if we're talking about something else, a cancer or maybe a lymphoma or one of those things, then that can develop very easily within a scope of 5 years or even less. A few months would be enough for some of these tumors.
With that, we formally conclude this afternoon's Webicon. This would not have been possible without the collaboration of different departments in our hospital, our media partners, and most of all, our valued patients, partners, and guests. Thanks so much, everyone, for making our Webicon a success. And I saw in the chat box some of our patients sending messages. We thank you once more for being very gracious and for valuing us, your doctors. To our speakers, Dr. Ted Bisagas, Dr. Gilbert Ranyoa, Dr. Maria Luisa Chambeng, thank you so much for spending your time in making this 9th Webicon series happen. We hope that we were able to enlighten and motivate everyone to never forego medical treatment as we ensure everyone's safety in providing world-class medical care. Always remember, here at Cardinal Santos Medical Center, you have a village of medical experts working hand in hand to save lives.